Okay, Nina, thanks for coming today. Before we finish, I'd like to ask a few questions about your health habit. Do you currently use any tobacco or nicotine products?
Yeah, I smoke. Not a lot, maybe 5 cigarettes a day. It helps me deal with my stress.
Thanks for being open with me. Can you tell me more about when you usually feel the need to smoke?
Mostly in the morning with my coffee, and then later in the day when I'm overwhelmed or around friends who smoke.
That makes sense. Smoking often become linked to a daily routine or emotional triggers. How long have you been smoking?
About 6 years, I have tried quitting a couple of times, but always go back when I'm stressed.
I appreciate you sharing that, Nina. Based on your oral exam today, I've noticed the sign of gum inflammation and early recession, especially your lower front teeth. This area is where tobacco really has an impact. But this picture is like someone who smoked more than 20 years. So before becoming like that, we want to prevent to quit smoking. As your dental hygiene student, I'd like you to know that the best thing you can do to protect your teeth or gums is to quit smoking. What do you know about the effect of smoking to gum health?
Not really.
You're not alone. Smoking reduces blood flow to the gums and delay healing, increase plaque and calculus buildup, and raise your risk of periodontal disease, even oral cancers. We have a next week like education session about the oral cancer self screening, but here is a like general information how to do the oral health self screening at home. It generally just check up your inside your mouth any lumps or redness. So you can have a look and then try at home and then let's review next appointment. Is that okay?
Yeah.
And it's also important to consider the broader health risks such as cardiovascular disease or lung disease or even cancers. And smoking harms not just for you but those around you like family members. And secondhand smoke can worsen asthma, increase the risk of lung infection, and harm unborn babies, leading to low birth weight or development issues. So can I ask you on a scale of 1 to 10, how important is it for you to quit smoking?
I have 7
Why did you choose 7, not something lower like 3 or 4?
because I know it's bad for me. I get rid easily, and I hate how it affects my breath and my teeth.
How confident are you that you could quit on a scale of 1 to 10?
Maybe a 3. I have tried, but always go back to it when I'm stressed.
What do you think made quitting hard before?
Mainly stress and being around friends who smoke.
What could help you feel more confident at this time?
Probably sport like from my sister and maybe enjoying nicotine patches.
That's great idea. If you're thinking about quitting, there are both over-the-counter and prescription medication options. So for the over-the-counter option like nicotine patch, gums, or lozenges help by slowly replacing nicotine to reduce the craving. But they are affordable price between 10 to $30 and available at most pharmacy stores. And on the other hand, like prescription medication like bupropion and varenicline work differently. Like bupropion change brain chemistry to reduce craving, while varenicline block nicotine receptor to make smoking less satisfying. So both has a little of the side effect, which include like dry mouth and nausea or difficult of the sleep. But the cost vary from 60 to 120 per month. I know it's quite expensive, but there are many plans or quit program can help cover them. So what kind of support do you think would help the most?
Maybe patches and gum. I would like to try a quit smoking app, and that's my friend said it is useful.
That's great idea. If you woke up tomorrow and were completely smoke free, what would be the biggest benefit for you?
Morning energy, saving money, and not feeling cluttered around my knees.
Yeah, I feel you're almost ready to quit, so you are doing a great thinking this draw. Would you be open to setting quit date?
Maybe next Monday.
That's good start, but I'd actually recommend trying to coming Saturday. Weekend can be a little bit easier because less work stress, and more time to focus on yourself. How does that sound?
That actually makes sense. Saturday sounds better.
Great. So from now you can start like preparing, like remove tobacco from your environment and tell your friend or family to support your plan and maybe start cutting back a little bit. I will also go over the different nicotine replacement option with you. Here is a frequent Q&A about nicotine replacement therapy, about the smoking, and you can go through to have a look, and I'm gonna hand it to you. Okay, great. From now, you can start preparing, remove tobacco from your environment, tell your family or friend to support your plan, and maybe start cutting back a little bit. I will also go over the different nicotine replacement option with you. Here is a frequent Q&A about nicotine replacement therapy. So you can have a look briefly, and it can help prevent craving actually. And also, I will letting you know here is a smokers helpline numbers, and they offer free support by phone, app, or even online chat. There you are.
Yeah.
And let's also schedule a quick follow-up for next week. So we will talk about how it's going or any adjustment you may need. Is that okay?
Yeah.
Okay. Okay. So just to summarize, we've talked about the odor and systemic health risk of the smoking, including its effects on you and those around you. And you've chosen coming Saturday as your quit date and are planning to use nicotine replacement to help with your cravings. You will also reach out to your sister for support and consider a quit smoking app. I will following up with you next appointment. Nina, you made a important step today. Do you have any question or concern about it?
No, I'm good.
Okay, see you next week then. Thank
See you.
you.